Dear friends, let me ask you honestly. Have you ever thought about the fact that the position you sleep in every night may either help protect your heart or slowly harm it? Most people over 60 pay close attention to their blood pressure, diet, blood sugar, and medications. But almost no one stops to think that one of the most important habits for heart health begins late in the evening, the moment you lie down in bed. As a doctor, I often see the same situation. A person tries to take care of their health, follows medical advice, takes prescribed medications, yet continues sleeping every night in a position that may worsen breathing, increase strain on the heart, and interfere with the body's ability to fully recover. And what's most surprising is that many people have absolutely no idea. Sleep is not just rest. It is the time when your heart should recover, your blood vessels should relax, and your body should essentially repair itself after the day you've lived. But if your body is in the wrong position, that process may be disrupted. Today, we're going to take a detailed look at why your usual sleeping position may be quietly harming your body, which position may actually help support your heart, why this becomes especially important after age 60, and what simple changes could dramatically improve how you feel. And perhaps after this conversation, you may never look at sleep the same way again. Let's begin with the most important question. Why is sleep so critical for your heart? When you are awake, your heart works in an active mode. It responds to movement, emotions, stress, food, and physical activity. But at night, during sleep, your cardiovascular system is supposed to shift into recovery mode. During sleep, your heart rate decreases, blood pressure stabilizes, stress hormone levels drop, blood vessels get a chance to relax, your body restores cells. Simply put, quality sleep is maintenance time for your heart. But if your body position interferes with breathing, reduces healthy blood flow, or creates unnecessary pressure on your organs, your heart may not fully rest. Instead, it may continue working under strain. Now imagine this happening not for one night, but for years. This is one reason many older adults often say, "I wake up exhausted. I feel short of breath at night. My heart races. My blood pressure is high in the morning. I have swelling. I feel tired even after 8 hours of sleep." And very often, the issue may not just be age, but sleeping in the wrong position. One of the most common mistakes is sleeping on your back. Many people believe sleeping on the back is ideal. Your spine seems straight, your neck appears supported, and it feels logical. But after age 60, things may change. When you sleep on your back, your tongue and soft tissues may fall backward. Airways can narrow. Snoring may worsen. The risk of sleep apnea may increase. Sleep apnea is when breathing repeatedly stops for short periods during sleep. You may not even remember it, but your brain and heart experience real stress. Every pause in breathing can lower oxygen levels, raise blood pressure, force the heart to work harder, increase the risk of irregular heart rhythms. This may be especially concerning for people with high blood pressure, coronary artery disease, heart failure, excess weight. Sometimes a person believes they are simply sleeping poorly, while in reality, their heart may be struggling for oxygen night after night. Now let's talk about sleeping on the right side. This position feels comfortable for many people, but it also has important considerations. For some older adults, sleeping on the right side may worsen heartburn, acid reflux, pressure on certain organs, discomfort in specific heart conditions. Some patients with heart failure also report that breathing feels more difficult in this position. But here's where it gets especially interesting. Sleeping on the left side. Why is it discussed so often? In medical discussions, this position is often considered beneficial for many people, especially when it comes to circulation and breathing. Why? When a person sleeps on the left side, Blood return to the heart may improve. Acid reflux may decrease. Airways may stay more open. Snoring may lessen for some individuals. For certain people, this may create more comfortable nighttime conditions for the heart. But I want to emphasize something very important. There is no one perfect sleeping position for everyone. For example, certain lung conditions, left shoulder pain, specific forms of heart failure may make left side sleeping less comfortable. That's why the best approach is not blindly following advice, but understanding your own body. Now let's discuss signs that your sleeping position may be harming you. Pay attention if you wake up with a dry mouth, experience a racing heart at night, frequently wake to urinate, feel exhausted in the morning, have morning headaches, are told you snore loudly, feel chest pressure while lying down. These are not always harmless inconveniences. Sometimes they are your body's warning signs that nighttime recovery is being disrupted. Your pillow, an underestimated factor. Many people change mattresses, take medications, and complain about poor sleep, while continuing to use the wrong pillow. A pillow that is too high, bends the neck, may restrict airflow, can worsen snoring. A pillow that is too low, reduces support, creates tension, may increase pain. The goal is to keep your neck in a neutral position. This is especially important for older adults because age-related spinal changes can already affect sleep quality. Your mattress matters too. A mattress that is too soft may cause your body to sink, affecting spinal alignment and chest positioning. A mattress that is too firm may create pressure on joints. Balance is essential. Now let's address another major issue: nighttime trips to the bathroom. Many older adults assume this is simply a normal part of aging, but sometimes frequent nighttime urination may also be connected to fluid redistribution while lying down, heart failure, or breathing disturbances. Once again, sleeping position may play a role. So how can you safely change your sleeping habits? If you've slept in one position for decades, sudden changes may feel uncomfortable. I usually recommend using supportive pillows, placing a cushion behind your back, gradually practicing side sleeping, monitoring your breathing, paying attention to how you feel in the morning. Changes should be gradual. Now, an important warning. If you experience chest pain, nighttime shortness of breath, severe snoring, suspected sleep apnea, swelling, unstable blood pressure, don't rely only on changing your sleep position. Please speak with your doctor. Sometimes the issue is deeper than it appears. And still, here is the most important message I want to leave you with today. After age 60, sleep is not just rest, it is therapy. Rest. Every single night either helps your heart recover or slowly adds more strain. Think about that. You watch your diet. You monitor your blood pressure. You take your medications. But are you paying attention to the position you spend 1/3 of your life in? Sometimes the simplest changes create the most powerful results. Turn onto your side. Choose the right pillow. Pay attention to your breathing. Do not ignore snoring. These may seem like small things until they become life-changing. Conclusion. Most seniors truly don't realize that the wrong sleeping position may affect the heart, blood pressure, breathing, and overall quality of life. Sleeping on your back is not always ideal, especially if snoring or sleep apnea are present. Sleeping on the right side may not work for everyone. Sleeping on the left side may be more supportive for many people, but individual needs matter. Your sleep should not exhaust your heart, it should help protect it. Remember, health is shaped not only by what you do during the day, but also by how you sleep at night. And now I'd really love to hear from you. What position do you usually sleep in? On your back, your right side, or your left side? Leave a comment below and share whether changing your sleeping position has ever affected how you feel. And if you found this video helpful, be sure to subscribe to the channel so you don't miss more important health advice about heart wellness, longevity, and living better. your health is in your hands.